Mental illnesses are a big part of the discussion of mental health. They are the leading cause of disability in both males and females in the US, with about 47 million people that have a mental illness, while around 970 million people have a mental disorder worldwide. Within the US, 1 in 5 Americans experience a mental illness each year, while 1 in 25 will have a serious debilitating mental illness within their lifetime. With so many people around the world living with some kind of mental disorder, it's important to talk about what they are. Some of the different categories of mental disorders defined by the DSM-5, which is used to diagnose mental illnesses in adults, adolescents, and children, include neurodevelopmental disorders, psychotic disorders, mood disorders including bipolar and depressive disorders, anxiety disorders, obsessive-compulsive and related disorders, and trauma and stressor-related disorders, eating disorders, substance-related and addictive disorders, and finally, impulse control and conduct disorders, personality disorders, and neurocognitive disorders. One of the most serious issues that may stem from having a mental illness is the risk of suicide. It is the third leading cause of death in teenagers and young adults. And in 2018 alone, 48,000 people died by suicide in the US, 90% of whom had a diagnosable mental illness. This means that about every 11 minutes, someone died by suicide in the US alone. Knowing that mental illnesses can have serious and harmful effects, it's also important to address the causes. A variety of factors, including a person's genetics, brain chemistry, and environmental stressors, can increase a person's risk of developing a mental illness. However, it's important to understand that while genetics and other biological factors may increase the risk of developing a mental illness, they may not impede the treatment process. Through the use of medication or different types of therapy, recovery is possible. Now that we have a basic understanding of mental illnesses, you might be wondering why it's worth learning about them even if they may not affect you. Because mental illnesses are so widespread, chances are you know somebody who has one. Being educated in the topic of mental health and the variety of mental disorders and how they affect people will allow you to be 1. A bit more understanding of people with mental illnesses, 2. Have a better understanding of your own mental health, and 3. Help people seek treatment. Finding treatment for mental illness provides a chance to recover and lead a higher quality life, but can also prevent further issues through the development of effective coping skills. By educating yourself and spreading awareness, you and those around you will be 1 step closer to eliminating the stigma around mental illness. Now for a quiz. Number 1. What are the risk factors for developing a mental illness? A. Genetics, B. Brain chemicals, C. Environment, or D. All of the above. The correct answer is D. Number 2. Suicide is a blank leading cause of death in adolescents and young adults. A. 4th, B. 3rd, C. 1st, or D. 2nd. The correct answer is B. Number 3. True or false? It is impossible to treat a person with a mental illness if they are genetically predisposed. The correct answer is false. Thank you for watching. If you enjoyed the video and found it informative, please consider liking and subscribing as well as sharing with friends and family.